This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Well, we're all in a good mood today, aren't we?
Yes.
I mean, we're ready to celebrate. Good morning and welcome to Health Watch. It's our usual spot here every Sunday, 8 till 9, Talk Radio 1210, WPHT. And as you heard the man say, Health Watch features Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. We talk about the who, what, when, where, why, and how of Innovative Medical and how they can help you improve your overall quality of life. And as I said, we'll do that with Dr. Molly Fantasia right here on Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. It's just another day, right? Oh, well, we're going to celebrate.
Yeah, you know what else, John? I know there's a lot of sleepy people out there, right?
Yeah.
And it was a rough game.
Yes,
it was pretty close. So thank
rough.
God. Thank God.
But, you know, it's a unique situation that you have at Innovative Medical because you don't do, and I should say you don't do, but you do a lot of good things for people.
We do.
But it's always difficult for people to understand it.
I know.
And you on an initial consultation, it takes like 10 minutes to discuss what it is, and then they kind of get it. But you talk about it here.
Well, you know what, John? You know, innovative medicine is really a cooperative of like-minded providers, healthcare providers. So we all work out of my primary care facility in Marlton, New Jersey. So we're able to do anything you might want to do within reason to an urgent care. If you need an x-ray, we send you right up the street for an x-ray. If you need to get a prescription med, you can leave with the prescription, or we can phone the pharmacy or get your prescription in. If you really understand our philosophy, you understand why we're cooperative. Our philosophy is we want to use the least amount of the pharmaceutical necessary, effectuate the change, don't put the patient at risk, find out some underlying causes of the problem, and thereby improve their quality of life by reducing the side effects of the medications, which are too numerous to count anymore, John. There's so many.
There are side effects to every medication.
Exactly.
Conversely, are there any side effects to your particular?
Sure, there can be. You know,
protocols?
if in terms of the protocols, even nutraceutical. Listen, let's go back. Hippocrates said, "Let your food be your medicine." This is how many thousands of years ago. So we know that the properties of food extracts can have desired effects and also some undesirable effects. But I can tell you in 26 years, we have had very few side effects for our patients because our delivery system at this point is very well documented and perfected.
How is the delivery system?
Hydration, and IV therapy. And more of these. I just read an article that said hydration therapies, IV therapies are one of the fastest growing divisions of healthcare. Well, Dr. Molly knew this 26 years ago, and I've kept up with the times. If anything, I would say that what's happening today, John, in terms of other types of facilities, is it's more based on spa-like deals. You know, get your cellulite removed. I'm talking about invasive type things where it's cosmetic in nature. We truly are a medical facility. So when a patient comes into us, we want to help them utilizing the hydration, utilizing appropriate vitamins, minerals, aminos, peptides, whatever we need to effectuate the change for that patient, not putting them at risk. And by the way, not only bypassing the digestive tract, but probably getting the results a little more quickly.
I want you to tell briefly the story of how you discovered this. And it's a fascinating story. it was a medical challenge that you had.
I had a challenge,
and a serious challenge.
Well, you know what's interesting? One of my new patients is the wife of the surgeon who took care of my medical challenge. Do you believe that?
Isn't that
she
that's,
just came in. Now, this is over 30 years ago. He was my surgeon, and he's no longer with us, but God bless him. He was a wonderful guy. But yes, I had a problem. I knew I wanted to get it out. I knew that, but I was working traditionally in clinical chemistry, which means I ran the laboratory. I was lab director for an institution in Philadelphia, and so I was traditionally trained. I have a traditional degree. In fact, my undergraduate degree, John, it doesn't even exist anymore. That's how old Dr. Molly is. It's an actual degree in medical technology, and of course, beyond that, of course, I went on for clinical chemistry and molecular biology. But the point I'm making is I was a traditionalist. But when I looked around at my alternatives, I said, my God, there's got to be something out there that I can do that is going to help me through this and be less caustic. And guess what? I started to do the research, and I saw that God, in his infinite wisdom, has given us many, many things that are available in the natural realm to help us.
And so from that, you kind of started this
journey.
Right.
I was very lucky. I got a medical director. My very first medical director had he came to me with very severe diabetes. He was in a wheelchair, and he couldn't function. He thought he was taking this as a short-term assignment. And it looked at, as God was my friend, and God is my witness, I said to him, Doc, if I can help you improve your diabetes to the point where you can walk again and do what you have to do, would you believe it? He said, no. And I said, well, will you give it a try? And he said, yes. And what happened is, not only did it work, he said, my dear, I'm going to be with you for my lifetime. And he was.
Then that's a great story.
And it's a true story.
And it's true. And I remember
you know the guy.
Yeah, sure,
you know the doc.
But, it just goes to show you that there are things out there that can cure this or can help it, I should say.
And not only that, but he was so instrumental in helping me really plow through the research. And the one thing I'm going to say to everybody out there, I have been so lucky in my professional career to link up with scientists, physicians, and pharmacists who really understand this and really aid me in the research I like to do and the availability of the products that I am able to use.
Well, we are coming up on our first break of the morning. Dr. Molly's going to tell us some real interesting stories coming up later on in the show. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210, 855-839-1210. You know what we say here on the show, call early because we want to make sure that we get to your call. And so you can assure yourself of that by calling early and getting in your question for Dr. Molly. 855-839-1210. It's Health Watch every Sunday right here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia. We both return with more Health Watch after these words. Back here on Health Watch, and operators, as always, are standing by right now at Innovative Medical Associates. And their number, 856-489-0505. Again, that's 856-489-0505. When you call, simply do one thing. Just schedule an appointment with Dr. Molly for the initial consultation. It is complimentary, and you're on your way to a better life. Let's put it that way. And if you want to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. And it is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. And Dr. Molly, I got to laugh at this one. There's a prefab cocktail.
Oh, yeah.
That is called the Dr. Myers cocktail.
Correct.
And what does this have to do with Innovative Medical.
Well, I'll tell you what it has to do. I get a call, and it's a friend of a patient, and I was told, listen, you're talking about your protocols. Well, there's this Dr. Myers, who's probably somewhere here in New Jersey, who has this protocol, and it's brand new, and he's probably doing it for $50 cheaper than you. So this was my wake-up call last Monday, and I said, what? I said, Dr. Myers, I said, are you talking about a Myers cocktail? You know what I'm talking about. This is the person on the phone. I happened to answer the phone Monday morning. I was the first one in.
Yeah.
Yeah, I said, I know about the Myers cocktail. I said, it is a traditional cocktail. By the way, Dr. Molly's a member of a lot of integrative groups. One of the very first IV therapies that were used nutritionally is this Dr. Myers cocktail. It's 20, maybe 35 years old. So it's been around a very long time, and it is a traditional written recipe that is in every integrative book here in the United States, everywhere, okay? It is definitely out there. So I said to the patient, yeah, I use Dr. Myers cocktail when needed, but I like to use an enhanced version because I found that it's a little bit inadequate today. And this woman said to me, what do you mean? This is brand new. I said, madam, please, with all due respect, would you believe me when I tell you it's been around at least 30 years? She said she really didn't believe me, John. So, I mean, these are the kinds of things. But the point of this is, it's very, very easy to confuse what we do with other things.
Yes.
And it isn't, I've had people say, oh, well, it's like chemo. It's as far away from chemo as you can imagine. So I want people to realize there's a lot of misnomers out there about hydration therapy. And again, I'm going to go back. We are not a spa. This has real value in terms of healthcare, quality of life of people going through real conditions, kinds of things, whether it's post-COVID, whether chronic fatigue, cancer, you name it. We've had them come through our facility, and I will tell you, in most cases, we're able to give them some improvement in their quality of life, and in many cases, tremendous improvement.
Can you show them data? Can
Sure,
you show them?
Sure. I can show labs. Last week I talked about a very specialized lab.
Yeah.
I had a very interesting patient this past week. She came in. She's the cardiac patient. I showed her about the inflammation that's going on with her, even though she said to me, but my echo is good. I said, your echo is good, but let's look at this vascular inflammation that's going on. So what do you think that test did for her? Eye-opener, because it showed her all of her markers that are obscure but there, and then put together an entire process which helped me change up her IV. She isn't a pure chelation protocol at this point, and even my chelation protocol, she isn't pure. I had to add some other amino acids.
So this whole thing about a Dr. Myers
Yeah,
cocktail.
well, there is
one.
I pray to God he's alive. I don't know, but yeah.
But really, it's not
it was
indicative
mixed,
of what you do.
No, and it's mixed up like usual. What happens is many times people hear something, and by the time it gets translated in the oral translation to get to me, it's completely screwed up, which is one of the reasons why I like to look at people's medical records and ask them to bring it with them, because what people think they hear and what's written are usually two different things.
That is true. So it really is indicative to really understand what your problem is.
Yeah.
And so then you can communicate better.
Sure. And believe me, I know about Myers cocktails, but I don't know if in most cases it alone does the trick.
Now, you've often had people say, well, you're a spa. And you've often said you are not a spa.
No.
And you don't do Botox.
No, we don't do Botox, and we don't want to do Botox. But the point I'm making, hey, not that there's anything wrong with it, like if to quote our friend Seinfeld, not that there's anything wrong with it. No. And if one of my docs decide to do Botox, that doesn't make us a spa. What the point is, my protocols are based in science, and they are specific for each individual need. So when you come into me, I'm not going to have a menu that says, you're drunk IV today, and whether you have a worse headache than ever or whatever. No, I'm looking at your entire problem of inflammation in any and all regard.
Okay, 855-839-1210. That's our number here. If you have a question or you have a medical challenge you want to run by Dr. Molly, 855-839-1210. You got an interesting email this week.
I did. From one of our listeners.
One of your listeners, and he's a pharmacist.
Right.
And I think you want to talk about this because it's really, it just points out, again, some of the things that you do that really are important to people.
Well, actually, this is a very nice man, and I've had the pleasure and the privilege of speaking with him on the radio. But he texts me, or he emailed the office, and he has a problem with his back pain, and he started talking about peptides. And it's something, of course, I spoke about on this show.
Yeah.
And, of course, you know, the FDA, in its infinite wisdom, has said that peptides in the body, using it medically, really is experimental, so to speak, because they consider peptides any polymer, which means it's got other things composed of 40 or fewer amino acids. Very different from the European model, which actually says it can be extracted from natural sources. So what we use are naturally occurring peptides, among other things, with the particular hydration protocol. But the short answer to his question is yes, we can assist him. And we've used the particular peptides that he spoke about. And I think it's incumbent. This is why we want to see a patient face to face, because we want to explain that, yes, the peptides are great, but it may not be the peptides alone. We may want to use it synergistically with some homeopathic extracts and some other things that may improve his lumbar, that may improve his thigh and knees. As you know, we have other protocols that can help eliminate knee pain, including PRP, the use of platelet-rich plasma, the use of MSCs. So which is a regenerative medicine term, we can use all this, but fundamentally, we have to look at FDA guidelines, which say that it's experimental. And it may well be, but I can tell you this. I have patient testimonial as well as data, radiological data, that shows we actually healed a patient's knee problem, and he's a runner. And by the way, his wife was in this week. He's doing a triathlon today.
Oh, my God.
You remember that case?
Yeah, I remember it.
So yes. So that's something we can show and definitely want to show. But it speaks to the fact that peptides, we've been using peptides probably within the last 2 years. And looking at the research, again, I am a scientist. I bless my physicians, both of them, who allow me to utilize these after reviewing my protocol, looking at the patient. They allow me to utilize these to help patients, and because they believe in this. Bottom line is, we're way behind the European folks in the use of peptides for many things. And if you continue to look at all of the literature search, which I do on an ongoing basis, probably once or twice a day, as you know, I'm looking for the development of new ways to deliver these peptides and to deliver the right ones. But it is very interesting because traditionally what they're doing is, I'm looking at natural peptides. In particular, I'm looking at them not only for pain, but inducing cancer cell death, or changes, right? And there are many of the natural peptides out there that can do it. But the traditionalists are looking at bioengineering these peptides to make them a drug type of things that they're able to deliver some of the chemos and the immunos and that kind of thing. So it's just a different approach. It's the same coin, just two sides of the same coin.
Yeah. Can you, this is off the wall. Okay. Can you write to the FDA and tell them some of the stories? No?
No, nor do I want to.
Okay.
Okay, so look, if anybody out there is with the FDA and listening to this, I mean, you can, look, the bottom line is we let people know that we're not curing anything. You know that, John.
Yes.
We're not curing anything.
You've said that.
But we sure
hundreds
can
of
give
times.
you a higher quality of life. And I will tell you that God has helped us do this. Good physicians look at this. And I'll tell you, open-minded physicians are looking more and more at this. And this is not unique to peptides, John. For example, we use a low dose of a particular pharmaceutical. So it's not that I'm against pharmaceuticals, but we'll use a subclinical dose to help people with neurodegenerative inflammation, like from anxiety, depression. We'll use it for pain, and we've used it quite successfully in fibromyalgia, chronic fatigue, and Crohn's disease. So, along with IV peptides. So, here you go. We can do things.
We could do a whole show on the FDA.
No, I don't want to, John. Please.
No.
Everybody out there, don't raise up the red flags on the FDA. But look, they have a job to do. You'll never hear Dr. Molly tell you, get rid of your traditional drugs. Won't do it. Will not do it. There are a lot of strides that have been made utilizing traditional drugs. But what I am saying is that there are some disadvantage to that as well. And one of the ways that we may be able to help you get through the disadvantage of using these things in chemo or immunotherapies is to utilize some of the God-given natural products to help you get through whatever.
Amen to that. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are already at the halfway point of our show, which means we still have plenty of time to take your calls. Questions for Dr. Molly? You want to run a medical challenge by her? Feel free. 855-839-1210 is the number. 855-839-1210. The show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly and I will return with more of Health Watch after these words. And we are back here on Health Watch. Again, the number for Innovative Medical Associates, and operators are standing by right now, so you can call right now if you like. 856-489-0505. That's 856-489-0505. Call now, make an appointment with Dr. Molly to really go over your situation, and that's where really you can get the information you need as to whether or not you want to move forward. It's very simple. And if you want to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. Check that out as well. A lot of good information on that. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And again, the number here in the studio, 855-839-1210. That's 855-839-1210. We always like to talk about patients and cases and so on and so forth. A post-COVID patient who you've been treating for a while. What's the status on that?
Well, John, if people who listened in last week, they heard one of my patient's wives, Tim's wife, call Jackie and talk about how well he was doing. But it is when they tell you that this is long hauling, it really, really is. I mean, this virus has done so much. And again, I mean, there's a whole school of thought out there, not just my thought, but a whole school of thought out there that sometimes maybe the vaccines have also caused a problem because people are getting COVID, and maybe the vaccines plus the COVID, and maybe other viruses are contributing to this and really making it more difficult to treat, not just the lung conditions, but the fatigue, the pains, the brain fog, and those kinds of issues. This is a nice woman who actually is married to a gynecologist. I think they're recently retired or recently got out, but they're young. They're probably our age or a little younger, John. And very, very nice people. And I like to call her a small doctor because she's been married to this man for 30 years, ran his office. So right. So she knows a whole lot, but he is also a very, very bright guy. And actually, at one point, he had referred someone to me, and we had a little chat about bioidentical hormone relationships with this patient. You want me to hold the thought here?
Hold that thought because we want to get to this call. Faith is in New Jersey. Faith, you're on Health Watch, and you're on with Dr. Molly.
Hi,
Good
Faith.
morning.
Hi, Faith.
Yes. Good morning, Dr. Molly.
Hi.
I have a problem that I'm embarrassed to talk about, but I'm so constipated and having such a hard time going to the bathroom, and I don't know what it's related to.
Okay. Have you been checked out by a GI guy or your primary care guy or?
No, this just started like about a
Hello.
month ago,
Hi.
not even. And I took laxatives and stuff like that to
Have-
help it along.
Oh.
But it doesn't.
Did you take anything natural?
No.
Have you taken anything natural? I'm
No,
going to tell
nothing.
you, I don't usually give out brands over. Okay, I don't usually tell you what to do, but a couple of things. Why don't you go to the ShopRite, one of the Acme, wherever, and get something called Smooth Move Tea? Smooth Move Tea.
Okay.
Do you have that written down, Faith?
Smooth.
Okay. Try that. A couple of cups of that, and maybe in the evening or early in the morning. See how you do with that. It's an old remedy. It has a lot of herbal, including something called slippery elm, I believe in it. But it is very, very good. It helps a lot of our patients. The other thing is maybe, I don't know, how old are you, Faith? How old are you, my dear?
I'm 74.
Faith? Okay, you're a
74.
baby. Come on, I'm 74. Stop. So one of the things, I don't know. Maybe you're not. Are you out walking a little bit and doing a little exercise, those kinds of things as well, or not so much?
I try, but I wind up having to run to the bathroom to urinate. So that's the other problem. It's one end and the other.
Oh.
So and I'm diabetic.
Oh my gosh.
So I know.
Yeah, now you're talking. So the constipation, although very uncomfortable, is not the only type of challenge that you have. So, one of the things I'm going to tell you to do is, you got to get back to your primary care doc. You want to make sure your blood sugar's under control. You want to make sure the diabetes is under control. Remember, that's a big molecule. Ask John, that's floating around, right? And I will tell you that, whatever's going on, and you really should be checked out by your primary as well, because
I guess
constipation
I'm
can be a
embarrassed.
symptom of something else.
Yeah.
Why?
I just
That's
am embarrassed.
ridiculous.
Yeah.
Come on.
I know.
Cut it out. Have them call me. I'll tell them for you, okay? But seriously, you're a nice lady. You shouldn't be suffering like this. Please remember, constipation can be a temporary thing, or it can be something more serious. I don't want you having a more serious problem related to your GI tract that we're not taking care of. Have you had your GI checkup? Meaning, either you did the colonoscopy or you did the molecular test for.
I did the box
Go ahead.
colonoscopy, and that was
good. And
when
what?
I did it.
How long ago was that?
About a year.
Okay, good. Excellent. And I recommend that. I like it because it's a non-invasive, and particularly for people who are a little squeamish about doing it. But Faith, really, pick up the Smooth Move Tea. Remember, there's Colace too, which is a stool softener that's traditional. It's been around for many, many years. My nurses tend to like that a lot as well. All right? I hope that helps.
Faith, thanks for the call.
Thank
Yeah.
you.
Thank you so
Thank
much
you.
for your
Appreciate it.
help.
Thank
Bye-bye.
you.
We appreciate it. A lot going on there.
Yeah, I know. Who knows? I mean, I would like her to be in good shape. She sounds a little weak to me.
Yeah.
And, that you wonder if she didn't have COVID. Anyway, getting back to our patient and with the COVID,
With
John.
the post-COVID,
Post-COVID, yeah. So anyway, the thing is, long hauling is just that. It's long hauling because people think it's just affecting your lungs. Well, your lungs are vital. Obviously, you need oxygen to your organs. This woman was smart enough to give us a call. She heard us on the radio. Her husband's been a long-time listener. She's been a long-time listener. But, I'm probably only on number 4 or 5 treatments. In this case, I do believe it's going to take around 20 to help get her to a point where she's feeling a little better. The fatigue is overwhelming, she said, and obviously that's true, because when your lungs are affected and other areas, you start to have a problem with additional problems with the fatigue and the brain fog. I'm finding more and more with that brain fog. People are going out on disability from this COVID.
That's serious
and these
stuff.
are people who would never even ever think about going out on disability, never had a problem.
We have Frank in the Northeast.
Oh, Frank.
Dr. Molly.
Oh, yeah, my favorite guy.
Good to hear from you again, Frank.
Hey, Frank, how are you?
Well, great of course, to talk to both of you again. But you know the old saying, if I did not have bad luck, I'd have no luck at all?
Oh, yeah, Frank, don't tell me something else is up for you. Oh, what's
Yes.
going on? Oh.
Thursday, I saw two different doctors, one for my shoulder, one a routine visit for I saw that open wound in my left foot.
Mm-hmm.
The first one, no big deal. I'm not worried about that. Told me I need a new shoulder, which I'm skipping that.
Of course.
But,
You're a smart boy. Go ahead.
The foot, they did an MRI on Wednesday because it was more like just tenure to touch for no apparent reason. The wound looks healthy on the outside. X-ray is negative. MRI showed osteomyelitis.
Yeah.
So
Frank. That's bad. In case people don't know. Wait a minute. Frank, you are a registered nurse and you're smart about this, but people out there might not know what osteomyelitis is, and that, of course, means bone involvement. So give them the definition of osteomyelitis.
Well, that's what I was getting ready to say. I was just saying on your behalf, once I said it, I said, well, let me just say it's an infection in the bone.
Right. Good man.
But it's that same bone area, I had a partial amputation of fifth metatarsal in 2012. And it's that bone continuum is about 4 inches left. They have to remove 2 inches, maybe an inch and a half of it. I have to go in tomorrow for prep. The surgery will be Tuesday afternoon.
Okay.
They're just going to do oral antibiotics afterwards, not even IV. But, I mean, I wanted to get your opinion about what you think post-op.
Frank, I think for your post-op, I would come in and get some IVs, okay? And I mean traditional IVs with antibiotic and maybe some antibacterial nutraceuticals. It'd be my pleasure to take good care of you that way. Everybody takes it, healthcare today isn't like it used to be. It's been streamlined, Frank. They want to get you in, get you out. They don't want to do these ask John, okay? 2 days in the hospital post CVA. So, we really, I think you're a nurse. I mean, you're always a nurse, even if you're not a practicing registered nurse. You're always a nurse. That sort of doesn't sit right with you. I can hear it in your voice. Please call me after the surgery.
You know what I like the most, Dr. Molly? I asked her on Friday. I said, will I be the first case Tuesday morning? She said, now we're doing same-day surgery first, so you'll be in the afternoon. So I'm going to have a surgeon maybe up here 15 case that day. She's going to be tired.
I know that, my friend. You know what, Frank? I will be praying for you. I'll have everybody in the clinic praying for you. I'll have Sister Fran do an extra prayer.
Thanks.
Okay? God
Good luck
bless
with that,
you.
Frank. Good
hey,
luck.
Frank,
Bye-bye.
God
And
bless.
keep us posted,
Yeah,
all right?
yeah.
Thank you for the call, Frank.
Yeah.
Is that serious?
Well, yeah, it's pretty serious. I mean, that means an infection in the bone. That is nothing to play with. And unfortunately, I'm sorry it came to that. We have a situation right now. I'm treating a patient whose wound has finally closed up. I have to give it to my nurse. One of my nurses, as you know, Catherine, she is a certified wound care nurse. And we were treating this holistically. We were treating it with some platelet-rich plasma, etc., meaning on the outside, caring for the wound. She looked at the wound. We measured it week to week. Right now, it's almost completely closed. We sent her to a different specialist than who she was going to, and they're saving her foot. The wound is clearing up. And Catherine said, Molly, we did a good job here. I said, I know.
We are coming up on our final break of the morning. Boy, time flies when you're having fun.
I know. It's fun to talk.
It's Health Watch here every Sunday, 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is the number. 855-839-1210. If you have a question or two for Dr. Molly, we have some time left, and maybe we can take your call as well. 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And I'm your host, John DeMasi. We both return with more Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock this morning. 856-489-0505. I'll say that slower this time. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. And you really would behoove you to call Dr. Molly and make that initial consultation, make that appointment, because it's complimentary, and you'll find out a lot about Innovative Medical and what they can do for you at that point. And again, the website is innovativemedicalassociates.com, innovativemedicalassociates.com. And we want to remind you that if you missed any of today's show, or if you want to hear it again, we have our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. Health Watch is the show every Sunday, 8 till 9, the live version right here on Talk Radio 1210 WPHT. We're going to go to the phones. Mike is in Jenkintown. Mike, good morning. You're on with Dr. Molly on Health Watch.
Hey, Mike.
Good morning, Dr. Molly. Thank you for taking my call. Please, can you repeat me this lady that's called before for constipation?
Sure.
Sure.
Hey.
This word.
Smooth Move Tea. Smooth Move Tea. It's very inexpensive. You can get it at any shop, or you can get it at a health food store. But you can probably get it at the one of the regular grocery stores, Mike. You know, and again, it's been used a lot. It has, and of course, don't forget the Colace if you need it. All right, which is a regular drug. Okay.
One more question: is this safety tickets with blood pressure medicine and blood thinner medicine?
I got blood pressure medicine.
Yeah. Are you asking if the Smooth Move will interfere with your blood pressure medicine? I do not think so. No, I don't think so. I don't think there's caffeine in it or anything like that. You know, we've used it. Yeah, we've used it a lot on patients because you're only taking a cup or something, okay? Don't get off your medications. But you know what, Mike? You should be looking at chelation, okay? And there are many hydration therapies that can work. Amino acids, including arginine, would be good. Magnesium might be good to do for the blood pressure. So, you know, you should think about that, okay? Thanks, Mike.
And please,
God bless
can
you.
Tell me which section and you have to look in if I go in the store?
Okay, God bless you.
The health food section.
Yeah, the health food section. Yeah. Or the health food section I think it would be in. And if you have a problem, go over to any place that sells vitamins, that kind of thing, okay?
Yeah, and they'll help
Herbs.
you.
Yeah. Okay.
Thanks for the
Mike.
call, Mike. We appreciate it.
So,
we wanted to talk about another patient.
Sure.
And this is a cancer patient
Sure.
who is not losing her hair. And that's a significant thing.
Yeah, because I gave her a little trick to do, which I'd be happy to share with people when they come in and see me. But what's interesting is she comes down from North Jersey. She's going to an extremely prestigious group facility up there, hospital and outpatient, big cancer center up there. So she has breast cancer. I mean, she was pretty devastated when she came in. She's probably been with me about maybe 5 months or so. She's doing so well. She had her follow-up PET scan this week. And interestingly enough, her tumors have shrunk, and the other tumors that were elsewhere have remained stable. Now, granted, she is doing the chemotherapy, but she never misses a week. She may miss one drip a week, because she usually does two, if she's too fatigued or too wiped out from the chemo. But she said, I don't even tell them anything, Dr. Molly. It's all for them, she said, because they laughed at me when I brought out the shower cap with the ice for my hair. And they proceeded to tell me that's going to interfere with my chemotherapy. And she said, don't worry about it. I think it's going to get to the tumors. Don't worry. And I may leave with a full head of hair. And guess what? That's what's happening. She's a real warrior. And that's the kind of patient who comes to me, patients who think. They look up what I say. They listen, I'm not the Encyclopedia Britannica. I want you to look up what I tell you, But they look it up, they get the idea, they speak to other patients, they look at other data, and they know that there's a real remedy to help them get through whatever they need to get through. And that's all I can say, John.
It's interesting because they would expect, it sounds like they expected her to lose her hair.
Oh, yeah. They said that one of the side effects of that particular chemo, it was. And you have to understand, for women, the hair is you can, actually for guys too.
Sure.
But most of my guys said they wouldn't wear the shower cap with the old. Do you remember a show called Toppers when we were kid?
Yeah.
Right. He was like a ghost, but he was drunk all the time. And he had this ice pack on his head that was like fabric, right? Well, they're still out there. And if you find that might be a good thing to use when you're getting chemo. Although, obviously, if you're having brain cancer or whatever, you may not want to use that. But
talk about the effect of your hydration when you're taking chemo. What does it do for you? I
think it has helped people's quality of life. It has helped them through this. And if God is good, there are some data to show that certain nutraceuticals have anti-cancerous properties. As a matter of fact, in the infinite wisdom, the FDA made a drug with a component of vitamin C, and it's getting very good results. The problem is you can only get it for compassionate care. But you'll find that amino acids and peptides, since we started with that, as well as vitamin C and other homeopathics, may have an effect on the cancer. I'm not saying it's curing cancer, but we have data to show that it may help in cell dysregulation, stop the cell from growing more. It can. And if you look around a lot of these foreign integrative clinics that are out there in Germany and Mexico, you'll notice that they're using combinations like I tell people to do. Get your chemo, get your thing. Then come and see me. There's ways we can do it around it. That's all, John.
And you've had many patients who have undergone chemo and have come for cancer support.
Right.
And that's a big part of your practice.
Right. And I've also had many patients who don't want to do anything. Sister Fran is one of them. She's a wonderful woman. She said, you just tell the surgeon do her job. I said, I'm not telling the surgeon to do her job. You tell her that. She said, that's what's necessary. Do the job. She just had a PET scan that showed she did have she only had a partial mastectomy. She does have a small lump on the other side. She had the biopsy. They're saying, just to be judicious, they should take it out. The lymph node was negative. Of course, they took that out. And she said, guess what I'm doing? She said, I'm not doing chemo, and I'm not going to do radiation. I'm coming to you an extra day a week. I said, well, thank you, sister. You might have to say some extra prayers for me and the whole gang.
Yeah, say some prayers for us.
That's what I said. Don't worry.
Yes.
But, that's the key, John.
Guess what? We're out of time.
All right.
With that, we are putting the wraps on another edition of Health Watch. Don't forget, we have our Health Watch replay 4 to 5 this afternoon, 4 to 5 right here on Talk Radio 1210 WPHT. 856-489-0505 is the number for Innovative Medical Associates, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. For Dr. Molly and everyone at Innovative Medical, the lovely Linda, Barbara, our nurses Catherine and Lana, and we have the fabulous Fran, we have delightful Dee, Joanne, and our medical assistant Karen Kathy. We all thank you for listening. Thanks to John Cole for filling in for Jim Kelly here on the program as well. Thanks a lot. We'll talk to you next week. We'll do it all over again. Health Watch right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.